As individuals, faith and spiritual leaders, representatives of communities and organizations of diverse faith traditions, we believe that the respect of human dignity and the value of human life is fundamental to each of our religions. We share a belief in the inherent value and worth of all human beings, a conviction that each person is a powerful agent of change, reflects the divine, and must be treated with dignity and respect, a commitment to relieve human suffering, a responsibility to reach out and respond to people who experience marginalization, and to protect people who are vulnerable. We believe that these values constitute the foundation for equitable and effective public health systems, for the provision of HIV services, as well as services for all other diseases, such as COVID-19, TB, and malaria, including in emergency situations.
Our commitments to action, compelled by our shared values and inspired by the stories of resilience and renewal shared at the HIV Interfaith Conference, Resilience and Renewal, Faith in the HIV Response, which took place virtually on the 22nd, 23rd, and 24th of September 2020, and by the recommendations made by the many participants from different countries around the world, and keen to promote the central role of positive faith and action to end AIDS as a public health threat, we commit to urgently take significant and sustained actions in the following areas during the next 10 years. 1, increase access to HIV education, prevention, treatment, care, and support. 2, promote the human rights and dignity of all people. 3, address HIV stigma and discrimination. 4, build bridges of collaboration among different faiths as well as between faith and non-faith actors.
As unique individuals and organizations, we each commit to using our gifts and strengths to ensure a focused and holistic faith response to HIV. We commit to exercise stronger, more visible, and practical leadership in the response to HIV by endorsing the commitments to action for individuals, faith, spiritual leaders, and organizations, signing up to its commitments and following through with actions, sharing the commitments to action with faith leaders and motivating them to take the actions required, amplifying the voice of faith leaders in our circles of influence and on social media. By committing to the 13 million campaign, which aims at promoting access to services to the 13 million children, women, and men living with HIV who are not yet on antiretroviral treatment. By endorsing the campaign and encouraging members of my faith community to sign and support it, supporting the identification of and collaborating with faith, spiritual champions of faith on HIV in my country and at global level. The 13 million campaign will involve at least 13 faith leaders in each of the world's countries to be strong and coordinated voices for the rights and dignity of all. By mobilizing action to help the 13 million people, children, women, and men who are living with HIV and are not yet on optimal life-saving antiretrovirals, to have access to such treatments, remain on treatment, and have their viral load suppressed.
At the end of the 4th decade of the HIV epidemic and in the face of many challenges posed by COVID-19, we call on each one of us and on world leaders to urgently act and recommit to support access to prevention information and services to all, to ensure that 95% of all people and children living with HIV know their status, that 95% of all those who know they are HIV positive have access to optimal antiretrovirals, and 95% of those on treatment have a suppressed viral load. We believe that achieving these targets requires strong and active participation by people of faith, religious communities, and other faith-based organizations. As people of faith, we commit to do our part to help achieve the 95, 95, 95 targets, and we invite others to join us.